Project Access is a nonprofit with an approximate staff of 20 people with expected future growth. Their mission is to assist people with little to no insurance overcome obstacles and lead them to critical specialty health care in a timely manner. Since 2010, Project Access has navigated approximately 1,800 patients using approximately $41 million worth of specialty care donated by area physicians. A founding member stated that in the first 9 months of operation, Project Access generated over $700,000 worth of specialty care using only $175,000. Our work with Project Access began with a conference call with their executive director. She expressed several goals for our team, including the creation of a policy and procedures manual, development of a survey to gather information on her team's thoughts about the PTO request and approval policy, and then drafting a new formal PTO approval policy using the survey results. We followed this meeting with research about these types of documents and created a timeline to accomplish the task. This process included investigating nonprofit groups and their policy and procedure manuals, weekly phone calls and emails with Project Access leadership, and a conference call with a Yale attorney. Lastly, we worked to integrate the knowledge gained during this class for the development of the manual. Project Access is highly connected to Yale New Haven Hospital. Almost everyone that works at Project Access is an employee of Yale New Haven Hospital by way of an employee leasing and support agreement. There are very few staff who are not Yale employees. In addition, Project Access is located at 150 Sargent Drive in New Haven, which is a Yale building. The space is donated to Project Access. About 70% of the practitioners who donate care to Project Access are also Yale Hospital practitioners. Lastly, Project Access has been given the opportunity to use Yale resources, including legal, human resources, and risk mitigation departments. Our first source of research for a nonprofit policy and procedure handbook was the National Council on Nonprofits. Their best practice recommendation is to include 4 main categories of policies and procedures, namely legal compliance and public disclosure, effective governance, financial oversight, and responsible funding. We considered multiple additional models from nonprofit trade organizations, including the Corporation for National and Community Service. We realized that it was also important to review other medical-based nonprofits to evaluate topics such as HIPAA, Officer of the Inspector General exclusion checking, and others. We located an AIDS research center in Ohio, which has published their policies and procedures manual online. This allowed us to incorporate an active manual for a similar organization. Because Project Access staff are Yale New Haven Hospital employees, they must follow many of the Yale New Haven Hospital's policies. For example, regarding the many HR issues such as discrimination and wages. This made it important for us to incorporate both the substance and style of their policies into the Project Access manual. After completing our initial rounds of research, our next step was to create a table of contents. This list was determined by combining information from multiple resources and filtering it based on the specific needs of Project Access. Our team wanted to use the Yale New Haven Hospital's policy style as a foundation for this project for consistency. This began by taking their PTO accrual policy and using it as a template to create additional policy examples for Project Access's use. 2 initial examples created were a policy banning smoking on campus and a staff cellular phone policy. This initial grouping was organized and shared with Project Access leadership. They provided feedback and additional information, which we then integrated into a cohesive policy and procedures manual for their use. The resulting model manual for Project Access opens with a welcome message from the Executive Director. This provides Project Access leadership an opportunity to set a tone for the document and communicate their thoughts about the organization and commitment to the contents of the handbook. It progresses to the mission and the vision statements. This allows staff to understand the goals of the group and can assist them with their day-to-day decisions. The document goes on to the rules overseeing the organization, including the bylaws and articles of incorporation. It is critically important for staff to understand the lines of reporting and management structure, so the org chart and a description of the leadership roles were included. Current versions of these critical organizational documents must be maintained in the manual for grant and audit reviews. We used the manual to define procedures, including the annual filing of the organization's existence with the Connecticut Secretary of State, the renewal of the Yale employee and property lease agreements, as well as the annual renewals of insurance policies. As we moved into the human resources topics, we regularly reviewed the employee leasing agreement with the Yale New Haven Hospital. Because of the employee leasing agreement stipulations, many of Yale New Haven Hospital policies and procedures concerning employees and other topics must be used and should not be changed or otherwise partially duplicated by Project Access. So we recommended that these superseding Yale policies be referred to and linked within Project Access, so as to not create inconsistent policies on the same topic. This HR section ended with the 2 sample policies we created for the organization's future reference. Our model handbook concluded with a section covering benefits. Like previous sections, much of this area deferred to the Yale New Haven Hospital benefits policies. Hyperlinks are provided to staff to access the most up-to-date version of those benefits maintained by Yale as possible. This methodology was chosen so Project Access would not have to constantly scan for updates in Yale's policies to keep the Project Access handbook up to date. The only addition to this was the development of the PTO approval policy. Since Project Access has the authority for the day-to-day control and supervision of the leased employees, there was no formal approval process prior to our involvement. We assisted with the development of the new PTO plan as detailed in the next several slides. One of our first major deliverables was creating a paid time off survey. In order to fully assess the needs of Project Access, we decided to immerse ourselves in the office culture by asking questions about some of the common issues that management experienced regarding paid time off. From the feedback we received, the main issues were staff requesting emergency PTO too often and using an excess of unpaid time off. As a result of these issues, Project Access was constantly experiencing staff shortages, which led to decreased revenue and employee dissatisfaction. After our discussions with Project Access, we set out to create the survey. We decided that Google Forms was the best platform for the survey because it was user-friendly on the front end and the back end. It was easy for the survey taker to navigate through the survey, and the interface for producing the results were easy to understand and visually appealing. We decided the best approach to the survey questions were to incorporate questions in which the only answer options were yes or no. If an employee answered no to any of the questions, they were prompted to provide feedback on their adverse answer and/or suggestions for improvement. We also included an open-ended question at the end of the survey to give employees an opportunity to address any areas that were not highlighted within the survey. The results of the survey reflected the major issues that our team assessed in the preliminary discussions. Based on the results of the survey, 100% of the staff agreed that an emergency PTO was usually granted, and 91.7% of the staff agreed that PTO was approved fairly, which solidified that the staff did indeed abuse emergency PTO requests and unpaid time off for emergency situations. However, the survey also provided some positive feedback in terms of how the staff felt about changing some of the current PTO approval practices. For example, 100% of the staff also agreed that a reasonable time frame to request PTO, 10 days or longer, was at least 6 weeks in advance. Google Forms produced pie charts to show the results of the survey. This made the results of the survey easy to understand, and it also saved the Project Access leadership team time and energy when compiling data to share with the staff members or with board members to address the PTO issues and facilitate changes in the PTO approval practices. We were able to assist Project Access in crafting 2 policies, the requesting time off from work policy and the Project Access work schedule policy. The requesting for time off work policy implemented a structure for employees when they requested their PTO. It required employees to submit initial requests for time off with their direct supervisor to ensure that proper coverage while they were out on PTO. This policy also required employees to request PTO for 3 days or less at least 2 weeks in advance. Any PTO that is greater than 3 days must be requested at least 6 weeks in advance. The Project Access work schedule policy addressed the differences between the staff in terms of FLSA status. The Project Access executive staff also decided to implement the Yale New Haven point system, which would address infractions like using unpaid PTO, arriving late, or departing early from a scheduled shift. Change is a difficult process for any organization to experience. So our team decided to provide the Project Access executive team with some recommendations as to how to best present the major changes that would be implemented with the onset of the new policies. The most important aspects of the rollout plan were to clearly state the changes and expectations that were being imposed on the staff, state how these changes would affect the day-to-day routines for the staff, and clearly state the consequences for violating the newly implemented policies. We also suggested that the rollout plan should take place in a forum that puts the staff at ease, such as a breakfast or lunch meeting. The main human resource recommendations our team made for consideration by Project Access leadership were to assess and address training needs on an ongoing basis, utilize Yale New Haven Hospital resources for staff training, include training on Yale New Haven Hospital point system and how to maintain a balance between caring culture and discipline, create a leadership team with cross-training, share patient cultural perspectives with physicians, consider OSHA workplace violence training, and seek leadership mentoring from external contacts and resources. The main policy and procedure recommendations our team made for consideration and future implementation by Project Access were to include a conflict of terms clause, since many of the Yale New Haven Hospital employee-specific policies must always be the controlling terms. Provide staff with easy access to all policies and procedures. Develop a method for training and review with staff, for example, by including 2 topics for quick review at each meeting. Monitor all policies and procedures and evaluate them for effectiveness. And finally, to champion a dynamic, ongoing review process by the board and the leadership team as Project Access continues to grow and evolve. Other PMP recommendations that were outside the scope of our collaboration, but still worth including for future consideration, were to develop a code and conduct that is unique to Project Access, its board, staff, volunteers, and donating physicians. Related to the Code of Ethical Conduct, using a risk-based prioritization approach, compliance policies, and procedures specific to Project Access and any potential for fraud, anti-kickback, and so on could be developed. For example, it may be useful to determine if OIG compliance guidance for healthcare organizations is applicable to Project Access as a facilitator of health services, though not a direct provider. Another possibly relevant policy for Project Access to develop may be a whistleblower, non-retaliation policy, and so on. This project has been a rewarding way to learn while helping others. Our team had the opportunity for hands-on human resources application. We had successful collaboration in developing and delivering the initial policies and procedures manual template, the staff survey on the paid time off procedures, and we had input on the new PTO request and approval policy. We also had the opportunity to develop a PTO training and rollout plan for Project Access and a template and method for future policies and procedures. Our team greatly appreciated the opportunity to assist advancing the organizational needs of Project Access of New Haven and its mission.